All right. So this was posted on Instagram today. Now I know people have like, like, oh, well, it should be worded like this and it should be done like this. And I agree with you. I don't disagree. But that doesn't take away that the boards are going to do certain things their own way. I do agree with you. Like some things are poorly worded and some things are vague and some things are specific, but it doesn't matter. You're still going to have to take that test, right? You're still going to have to take that test. So let's go through this using the method. Which of the following is the most appropriate action? So select all that apply. So what did I say about select all that apply? They're typically going to be signs and symptoms. They're going to be risk factors. They're going to be education. They're going to be concepts. So again, the big takeaway from this is if this is a real life board question, we got to think like them. Think like a test maker, not a test taker. So we've got a 38-year-old female patient complaining of right upper quadrant pain. So give me some risk factors of cholecystitis. How about fat, female, 40, fertile, right? So we've got 40, we've got female, we've got right upper quadrant pain. So these are all signs and symptoms or risk factors of cholecystitis. Well, if somebody presents cholecystitis, if somebody presents with cholecystitis or any type of GI issues, what are we going to do first? Those of you that are students of mine, NPO. But if we make them NPO, what are we going to start them on? IV fluids, and then give them what? PPI is needed and pain as needed, right? These are things that are going to be given. But we also talk about therapeutic communication. Therapeutic communication are 3 words. Tell me more. So what do I say to this patient? So I start from the bottom using the method and give them pain meds as directed. So yeah, if I've been told by an HCP to give them pain meds as directed, would I give it to them as directed? Of course, absolutely I would. Would they start them on PPI if needed? Yeah, if I've been ordered to, for sure. Well, I make them NPO because I have to give their GI a rest, and I do it for, what's the other reason why we do that? Make them NPOs. What if we have to do surgery? Yeah, 100%. So I make them NPO, but if I do that, I got to start them on IV fluids. And then I also have to make them NPO and then obviously then start them on IV fluids. But when they come into me and they say, I have this right upper quadrant pain, you're going to say, tell me more. Well, I have this right upper quadrant pain and like it kind of like goes all the way up to my right shoulder. Whoa, wait a minute. Now I got more. Oh, wait, I've had a family history of this before. Like my grandmother had gallbladder stones. Whoa, tell me more. So you see, those words are therapeutic communication, but it's giving us more, right? So in this situation, if this is a board question, yeah, it is all 5 of them. And now this is just 20, this is before April. These are going to get a lot harder because then I'm going to have a differential diagnosis as well too. We're going to have to know that we can choose all 5 and be okay with it, or we can choose 1 and be okay with it, right? So again, it's a concept that I teach in GI. I say, look, if somebody comes in, appendicitis, cholecystitis, diverticulitis, pancreatitis, it doesn't matter what they come in with. I'm going to make them NPO because I want to give their GI tract a break. I want to get them ready for surgery because I may have to go to surgery. But if I make them NPO for those 2 reasons, I've got to start them on something. But just think about it. If somebody comes into the ER and is complaining of anything, what's the first thing we get? We get IV access and we start IV fluids in every situation, right? For the most part, you come into the ER and guess what we do? IV access and fluids. Just get them started. Why not? We may need to draw blood. We may need this. It doesn't matter. Why not? There's no harm in it. Is there any harm in giving fluids? I mean, in 2 situations, there are SIADH and heart failure, right? Those are the 2 exceptions. But in all other instances with the GI tract, yeah, we're going to make them NPO. We'll start them on IV fluids, give them as directed pain and PPI, because if they're not eating anything, the last thing we want is a development of acid, and then we cause an ulcer, right? Or they get a stress ulcer because they're in the hospital. Give them pain meds. Well, if they're in pain, then we got to address the pain 100%, right? So patient to tell you about the pain, therapeutic communication. Cool. When is it the times when we do not use tell me more? Suicidal ideation and homicidal ideation. I don't want you to tell me more. I want to know, I'm gonna admit you, right? We're taking you against your will. Cool.